जी, Bismillahirrahmanirrahim. Assalamu alaikum. This is the part two of writing for international journals, preparing a manuscript from an original research project. So for original research writing, this video is about writing introduction. We have already discussed these are the content of entire series of manuscript writing, and we are actually now discussing about ICMJ guidelines and Equator reporting guidelines for developing introduction, writing introduction, and a convincing rationale. So when you structure a manuscript, there is a beginning, middle, and a conclusion or end. And this is the format or structure of an original research paper. Title, author's abstract, keywords we discussed in previous slide. And now introduction, methods, results, and discussion we will be discussed in subsequent slide. So in this slide we are going to talk about introduction. Writing introduction, starting from broader topic and coming to your research objective, question, or hypothesis. This constitutes the first beginning of the story, and it should be very in a logical, connected, sequenced way, and should start with a broader introduction of the topic, and then the subtopic, then literature review of the current knowledge about the problem, and indicating the gap in the literature, then introducing our own work, the aim and then objective of the study, and usually we give the problem statement and then the objective, research question, or hypothesis of the study. So I'm going to share a few examples with you to make you understand how to write introduction. And the literature gap, this is the research gap, and I will be discussing different types of gap in another video as well. But here, just to give you a brief idea, there are different kinds of gap, like population gap. If a study is not conducted in a specific population and you want to know, okay, what kind of outcome or findings we can have in this population, so we can claim a population gap on that. There is evidence gap when there is a limited number of published or unpublished evidence available on a particular problem. Or there could be methodology gap if different research methodologies, sample size, sampling technique, they are not adequately applied on a specific problem, then you can say there is an evidence, there is a methodology gap. For example, there are multiple case control studies are there and RCTs are there, but there is no system or limited number of systematic reviews or meta-analyses, or then in that case you can say there is a methodology gap and the guidelines need systematic reviews to be done. And the guidelines are informed by systematic reviews and meta-analyses because these are the studies of studies. So in that way, you can identify gap. And where to search the gap? The gap in the literature is usually, it is mentioned in the limitations of any paper in the discussion section. At the end of the discussion section, the gaps they are left by that study, they are usually mentioned in the limitations and implication section. So coming to the structure of literature review within the introduction, again, starting from background, narrowing the categories of research, then studies closest to your research, and then your hypothesis, objective, or research question. The three C's. One more important thing in manuscript, the introduction, literature review is combined. So in the introduction, you have to introduce the topic, introduce your study, and also give the literature review. Relevant, concise, and crisp literature review. So here, the three C's. Good writing possesses the following three C's: clarity, conciseness, correctness, that is accuracy, and the key is to be as brief, as specific as possible without omitting essential details. So we have to give essential details, but we have to be very brief and specific. Know the enemy. Good writing avoids the following traps: repetition, redundancy, ambiguity, and exaggeration. So be humble, try to be try to elaborate, interpret findings that are uh, genuinely concluded or identified in the study. Avoid generalizing findings that are not generalizable. For example, if you have not done a probability sampling or not having an adequate sample size, so in that case, you cannot generalize your findings. And these are common annoyances for editors. So if you are repeating things, for example, conclusion in abstract, usually we find authors writing the same conclusion, copy and pasting it into the main conclusion. So at least you should rephrase of that paragraph or add some more detail for the main conclusion. So this is one paper on missed opportunities for vaccination among healthcare seeking children, a cross-sectional study in Bishkek, Kyrgyzstan 2023. So here you can see these are multiple authors and they have their ORCID ID. The green icon is for the ORCID ID, and all of them they have their profile on ORCID. These are 1, 2, 3 number given with the first author, and other authors they also have two or three numbers. These numbers are the affiliation. So one is the primary affiliation, and 2 and 3 are the secondary affiliations. So you can give all your affiliations in the research paper. So coming to the introduction, for example, if you look at this paper, immunization is a critical foundation of infectious disease prevention and primary health care. Access to vaccines is considered a fundamental component of the right to health. However, there are global inequalities in the distribution of access to vaccines. So it's the starting sentences or the paragraph is about introduction, what is immunization, and what is its role in infectious disease prevention and primary health care, and why access is important, what global inequalities in vaccination are there. For example, they have given the example of COVID-19 pandemic, when the inequities, they are actually they become obvious, exacerbated. And in primary healthcare services and preventive medicine affected different groups unequally. The pandemic contributed to the largest decline in childhood immunization in over 30 years. So this was the largest decline, and they have referenced each and every sentence. So in introduction, usually the researcher he or she cannot put his own opinion or his own recommendation, suggestion, comments in the introduction. You have to reference whatever you are saying, except the last paragraph, that is the rationale and the your research question or hypothesis or objective. Okay. So he talked about zero vaccination. After giving an introduction to immunization and its situation after COVID pandemic, he again started talking about World Health Assembly, the global strategy to make the coverage 90%. So this was he's giving a target, sharing the target of the World Health Organization. And then in Kyrgyzstan, he's talking about in the third paragraph that there is poor vaccination coverage, and the national statistics, they are also telling about that the vaccination coverage is on average it was 91% in 2022. However, regions of the country report TTPC P3 coverage below 90% in Bishkek city, the capital with a population of 1.15 million. So he is actually comparing the Bishkek coverage with the national statistic over here and giving references. One strange thing is reference number 7 here, 7 here, and 7 here. Usually when the single reference is being used in continuation, then you can write the 7 number once at the end of the paragraph. There is no need to repeat with each sentence. Reducing missed opportunities for vaccination is an evidence-based strategy that is called MOVE to increase immunization coverage. So, a MOVE occurs when a child is eligible for one or more vaccine doses and has no contraindication at the start of a healthcare facility visit and does not receive their missing vaccine by the end of the visit. So this is MOVE, and he's talking about what is MOVE and what is the prevalence of MOVE ranges widely across countries, and 5% in Colombia giving the least value and giving the maximum value. Children eligible for vaccination could have missed opportunities for various reasons. Now he's talking about reasons in the last two lines of this paragraph, including healthcare workers' failure to review child immunization or vaccination records, parental refusal, treatment for a different illness, or health facility supply shortages. So he talked about different reasons, but here there is no reference given. So this is strange. If these reasons must be evidence supported. So this is something that we picked. One was about the numbering, and now no reference given to this an important, very important sentence. Uh, MOVE prevalence estimates were not available for Kyrgyzstan or Central Asia. So we aim to quantify the magnitude of this issue and identify the primary factors associated with MOVE to develop actionable solutions to reduce um, missed opportunities at the facility level. So here is mentioning the objective or aim of the study, and just about this first sentence is about the rationale, that there is no available published evidence on the prevalence of MOVE. So this one is the reason, rationale, and followed by the what he's going to do and what will be the implication. So rationale has three parts: why, what, and how it will implicate, what will be the implications. Okay, so now we will be looking into the checklist for writing introduction. And in an introduction, we have the opening or the context starts broad, explaining the topic and why it matters. For example, the public health relevance, clinical relevance, educational relevance of the problem. So you have to start broad, starting with the a broader topic, then explaining the topic, subtopic, and why it matters. So here the next step will be the literature gap, summarizes what is already known and highlights what is not known. So you are not going to give an extensive literature review in introduction. You just need to summarize what is already known. So for that you need to synthesize the literature. On literature synthesis, my another video is available on how to tips for writing a literature review, and there you can get to know how to synthesize from the literature. Okay, so once you have synthesized what is known, then you highlight what is not known. This is the gap in the literature, avoiding a full literature review. Then you give the problem statement, clearly states the research problem or issue being addressed. Then rationale or justification of your study, explain why this study is needed. Like we have seen the introduction, they say that MOVE is not calculated or assessed in that country, Kyrgyzstan, and you have to give the importance of this in the rationale of the topic or the area, novelty, and the practical value. In these are the 3 points. They can help you explain the why you need this study, the importance of this study, the novelty, and the practical value. Okay, then you will give the objectives. Usually journals, they ask you to give objective, otherwise you can give hypothesis if there is an hypothesis, and you can write research question as well. So ends with a clear research aim, objective, sometimes again hypothesis is also given if applicable. So coming to the style of introduction, there is a logical flow, move from journal to specific in a funnel shaped manner that I have already shown you. Concise, no unnecessary details or textbook style content. Okay. So balanced citation needed, uses recent and relevant references, not overloaded or outdated. Okay. Avoid overlap, does not include detailed methods or results that belong later. So here introduction, you need not to give references with their results and their method, because here you don't need that. You are introducing your topic and you are using the literature to support your topic, to give an idea about the a very balanced way. You have to make use of your citation. Try to be recent. Last 1 or 2 year papers are more than sufficient to write a manuscript, write an introduction. Okay. And engaging yet academic writing need to be there, written in a professional way, but in a precise tone. So again, an important thing while using references, if you find some latest systematic review on the topic, you can go through the studies that are being used in the systematic review, or if you find an RCT or recent research paper relevant to your findings or your study, then you can go through the references list of that paper, and that is called snowball referencing. That is a snowball that you find out your relevant studies from a studies reference section. So here you can find 20-25 studies very relevant to your study. So that will make your introduction writing easier. Okay. So this is an example of a bad paragraph. Vaccinations are important for children because it helps prevent diseases. That is the number one. Many children do not get vaccines, and this is a problem in many countries, especially since COVID-19 made things worse. In some places, people do not have access to vaccines, and this causes problems of health. Number three, some children miss vaccines, and this makes diseases spread. So it's you can see the tone, the professional language, unprofessional language, you can say, and the way it's written, the way it's the references are cited, because for the mixed opportunity, they have just used that the vaccine was missed by the student, by the patients, or by the population. So this is not actually the way. If you compare it with the previous introduction that was published in a paper, this is not a good way. In Kyrgyzstan, vaccines are given, but still some children do not get them. It's not professional. Some areas have low coverage, like Bishkek, but the exact numbers are not very clear. Missed opportunities for vaccines are also a problem. Children sometimes come to health facilities and do not get the vaccine they should. This can happen because of different reasons, but there are no studies from Kyrgyzstan. This study will look at this issue. So usually we face, or we receive papers with such kind of write-up. But if you go back and see the introduction written by in that paper, that was really good. So common pitfalls to avoid, starting with over general statement like since the beginning of time, humans have faced diseases. So this is not this is not a good right statement to start with or to write in the introduction. Making the introduction too long, that is more than 20% of the paper, that is not advisable, because if its paper is 2500 words, then introduction should be less than 1000, usually 700 to between 700 900 enough. Not clearly identifying the research gap, that is also a big pitfall, usually it happens. And forgetting to state the objective research question, this is one most frequently occurring mistake or pitfall, that usually authors, they don't write the objective or research question at the end of the rationale or at the end of the introduction. So consult the guide for author for word limit. You have to do that. Set the scene. Again, it's very important. Outline the problem and hypotheses. Again, very important, very crucial. Ensure that the literature cited is balanced, up to date, and relevant. Define any non-standard abbreviation and jargon over here. So here you have to give, for example, if you're talking about some tool to assess depression, so you have to give different types of tools available or and validated in different languages. So and why this tool is important, or use, because you are going to select, you have selected that tool, so you have to give some clue about that tool over here. Comparing with other, for example, this is a the EPDS scale, Edinburgh Postnatal Depression Scale, is a short scale, easy to administer, easy to understand. It's available in multiple languages. For example, I'm from Pakistan, it's available in Urdu. So these are the features that will make it appropriate for your study, and you are giving the details in introduction as well. So what not to do: write an extensive review of the field. I've already told you. Cite disproportionately your own work of your colleagues, or work that support your finding, and not involving or writing the contradictory studies or work by your competitors. So this is very wrong. Balanced citation is very important. Describe methods, results, or conclusion other than the outline, what was done and achieved in the final paragraph. So here you cannot write method, result, or conclusion. Overuse terms like novel and for the first time. So you cannot use absolute terms, none, novel, uh, no research available. So these are the, or for the first time, these are the terms that must be avoided in a paper. So thank you very much. My next video will be about the method section of an original research paper.